doesn't kill you, makes you stronger.
I've always loved this song, but especially in October, Breast Cancer Awareness Month. It happens every year. Over 250,000 women across the United States get diagnosed with this disease. Unfortunately, that number continues to grow every year.
And today, oncologist at Memorial Sloan Kettering Cancer Center, Dr. Elizabeth Comen, is here. She's back, I should say. Welcome back to the program. I got some hopeful news about treatment, everyday preventative measures, and how simple screenings can not only catch cancer early, but save lives. We welcome you back. And I kind of overheard you speaking a moment ago before we came on. You said this is an exciting year when it comes to treatments for metastatic breast cancer. What are you talking about here?
Absolutely. It's been an incredible year. So metastatic breast cancer are breast cancer cells that have spread from the breast to other parts of the body. And a new study this year came out of my hospital and my colleagues, so I'm very proud about that, is a treatment called TDXD or Enhertu. And it's particularly important because it showed an improvement in overall survival for women with metastatic breast cancer. And in particular, a subclassification called HER2-low metastatic breast cancer. So if anybody is watching with metastatic disease or knows somebody with metastatic disease, they should really ask their doctor, do I have HER2-low metastatic breast cancer? And might this treatment be helpful for me?
And I wanted to jump in really quickly for people who don't understand, because I didn't until I was diagnosed with, I was stage 2, that stage 4 right now is uncurable.
Yes. But the point is we have incredible new treatments that are helping women not only live longer, but live better with the disease.
And that's why it's so important,
Exactly.
because it used to be this hopeless diagnosis, and it's not anymore.
Exactly.
So we talk a little bit about treatment, especially for the stage 4 or metastatic breast cancer, but let's go back to prevention, because so often when a woman is diagnosed, then she has a family and they then live in fear, like your daughters, like millions of daughters who are dealing with this with their moms. What can be done to lower risk? And not that it's anyone's fault when they're diagnosed, but there's so much in our control that we can do behaviorally. So talk us through some of those things.
And of course there's so much with cancer that is out of our control. We can't control getting older, we can't control our family history. But yes, of course, there are some things that we can do, including exercise. Not all of us can maybe run marathons like you, Amy, but we can have exercise snacks. We can do squats while we're watching TV. It's so important that we move our bodies. Number 2, we also know that maintaining a healthy weight and decreasing our consumption of artificial, really processed foods, less meat, more fruits and vegetables is critical. Decreasing our alcohol intake as well as stopping smoking are some of the things that are really important for cancer risk reduction.
And can you just do a deep dive a little on the alcohol intake? Because I have so many patients who are afraid of hormones because of that link to increasing the risk of breast cancer, but alcohol intake is actually a more significant risk factor. So talk about that, because that's something that even women in their 20s
Of course,
can do.
And a lot of us don't want to hear that. We use alcohol to celebrate. It's so much a part of our culture. But we do know that alcohol is associated with an increased risk of breast cancer, but also many other types of cancers as well. So one of the things I tell my patients and my friends, if they want to hear it, is ideally less than 3 glasses a week of alcohol to decrease our risk as associated with alcohol.
We've talked a lot about controversies in the world of breast cancer. It seems there's no shortage of that. One of them has to do with screening and doing self-breast exams. I always feel if something's a part of your body, you should know what it feels like. What do you tell patients?
I tell them exactly what you say, so we're very aligned. I think people should know what their breasts feel like. They're on them. They should be empowered to know what their breasts feel like. And it can be so important for some women, because particularly women under the age of 40, where we're not necessarily doing routine screening, that is in many instances how some women are finding their breast cancers and bringing it to the attention of their doctors. So there are great resources online about when and how to do a self-breast exam. But for me, I am absolutely in favor of them.
And there's also a lot of controversy about who should get screened, what type of screening you should get, when and how often. What are your suggestions? What do you tell your patients?
So for the average risk woman, and what I mean by that is women with no known strong family history or a known genetic predisposition, I recommend that we start screening at age 40. If a woman has dense breasts, we're going to do consider at least an ultrasound on top of a mammogram or perhaps additional other imaging. that should happen about once a year, ideally at a reputable imaging center with a board-certified radiologist. So it's incredibly important that women talk to their doctor if they are at higher risk potentially of breast cancer because of a family history or other mutation that they may have inherited.
As you know, and I always say this though because I had no family history, more than 80% of breast cancer patients have no family history. So that's just an important statistic to remember, and it's what put me into that mammogram when Robin Roberts told me that, because I kind of thought, well, if you have family history, you should be concerned. If you don't, you're good. And that's just not the case.
Exactly, but the other point is that when we do screen and we do catch cancers early, we improve the outcomes for patients. And that's why it's so important that we remind everybody to go for that routine screening. The earlier we catch cancers, the more likely we are to improve outcomes and ideally have less invasive and less toxic therapies.
So important. Dr. Comen, you are always a pleasure to have on the program. Thank you so much for everything you do and the message you just gave our viewers.
Thank you for having me.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.